Welcome back to a new episode of Skin to It, your guide to healthy skin.
I'm Marlo Sutton, fashion stylist and beauty enthusiast.
And I'm Dr. Sandy Skotnicki, your trusted dermatologist.
Today we're diving into an exciting topic.
We'll break down everything you need to know about skin pigmentation and share tips to help you care for your skin like a pro.
So grab your notepads and let's get into it.
So today we're going to do one of our 101 episodes, which is sort of a deep dive into a topic. So we hope that you come away with like a very good understanding of it, more than you can get with just like a 30 second or minute reel. And today is all about skin pigmentation 101. Why do people have more pigment? Why do some people have less? All the problems with pigmentation, from sun damage, etc. And we're going to take a really deep dive.
Okay. Yeah. No, I know so many people who have so many issues with this, and I don't think the solution is that simple.
No,
because there's a lot of different causes.
Yeah.
So I guess, my one, maybe it's a myth about it, but is it really just about aging? Like, are we just getting these spots as we age, or is there skin changing as we age?
So I know we like to have some funny stories. So when I was training as a dermatology resident, we had this very old dermatologist. Now, he was 80 when I was training, so that's a long time ago. So he graduated before there was antibiotics. Okay. Dr. Montgomery was his name. He's passed on now. He's a wonderful mentor. And he used to get a little upset because when I started to train, anti-aging and, Botox hadn't even, I'm aging myself, it hadn't actually been released yet. Like it hadn't been discovered. It was used for non-cosmetic. And when patients would say, Dr. Montgomery, I have this browns, I have a bit of brown, I have some wrinkles. What anti-aging stuff should I use? And he'd get so mad, he'd stand up and he'd say, go home and look at your backside. All you need is sunscreen. And of course, then we'd have to tell him about retinol or something like that. And so it's not just about aging. And I do tell people, like people come in and say, I got all this brown stuff on my face. I wasn't in the sun this year. And I'll be like, well, how old are you? You have 53 years of accumulated sun exposure. And, if you really want to see what your skin looks like at this age, you go look at your backside. Or the inside of your arm, right? So it's definitely about that, but it's not just about that. Because you can lose pigment. You can get melasma, which we're going to talk about. You can have age spots that are brown. Like there's a whole host of reasons to get pigmentation. But one of the big ones is, obviously sun, UV exposure.
So just a couple of questions. Sandy always makes fun of me, but of course, when she puts out a topic, first thing I do is I go on TikTok and I start going down rabbit holes. And one thing when I just kind of typed in pigmentation and skin pigmentation, I saw this doctor, I think in the UK, who is changing people's eye color.
Yeah, you told me about that. That's crazy, man. Yeah.
So
I get the name for that, keratopigmentation. Yeah. So is it possible to change your own skin color or your own eye color or your own hair color because that's genetic material coding that, right? So apparently this fellow, and he's not the only one, you can make a slit into the cornea and you can inject dye and pigment into the iris. The iris is the muscle that opens and closes, and it's the one that carries pigment, which is genetically coded for. But it's got a lot of concern, right? Yeah, inflammation, blindness. Like it's not something I would ever recommend. Get a contact. You want blue eyes? Get a contact. I don't know. It's crazy, but that's a good segue into what is pigment? What is coding that? What does it all mean? So why don't we start there?
Do you want to get into that?
Let's get skin to it. Yeah. So what is skin pigment? Okay. So the cell that makes color, which is melanin, is called a melanocyte. And interestingly, I had to double check this right before the episode, is we all are born with the same number of melanocytes, even patients of color. It's about the amount of melanin. So the cell is pumping out this pigment called melanin. That's what gives us color. That's what is increased when we tan. And there's different types of melanin. It's beyond the scope of this discussion, but there's eumelanin, different types of melanin. That's why some people have red hair. It's a different type of melanin. It's not as dark. And so the amount of melanin and the type of melanin determines your skin color, your eye color, whatever it is.
So when we've talked about sunscreen, obviously a lot, and I remember you saying that actually the melanin in your skin is your natural UV
Very
protection.
good. Yes. Yeah. Do you remember
You
what
see, I do remember certain
listen.
things.
So a tan is technically an SPF about 3 to 5. And it's your body doing its damnedest to try to protect yourself, right? From the damage of UV rays. That's what a tan is. It's not healthy,
Okay.
contrary to popular belief.
It can make you look healthy, but no, safely for sure. So why can some people tan and some
So
can't?
that goes again back to what I was saying. So we're all born with the same amount of melanocytes. So those are the cells that make color. It's the amount that we produce and the type of melanin. And that's just genetically coded, right? So we have this scale in dermatology that's called Fitzpatrick skin types. It's named after the doctor who described it. There's 5 of them. So Fitzpatrick 1 patients have very little melanin. They don't produce a lot, so they burn easy, they can't tan. And on the other end of the scale is patients of very dark color, right? That don't tan or burn because they're very dark color. So we use the Fitzpatrick scale for assessing risk for skin cancer. We use it when we're setting limits for lasers, like depending on how much natural pigment you have, we'll set the laser at different levels. So it's genetically encoded.
Okay, I think I know the answer to this, but talking about genetics, I've also seen people who have like one white streak of
Talked about
in their
that, yeah.
hair.
So that's called the technical medical whatever term for that is pedballism. And so again, it's genetic. That for whatever reason, they like our bodies. When we're in in an embryo, the cells are sort of moving all over the place, right? And so sometimes the cells just don't go. There's all kinds of weird pigmentary abnormalities that are genetic that are very rare in dermatology that we'll see. But this is where the pigmented cells just don't go to this little. I think they're probably coming up this way in production, like when the embryo is growing, and
for
maybe,
people who can't see, they're coming.
yeah.
When you say,
oh, that's right, the listeners. So I'm doing it. So the cells will migrate in an embryo, and they're on migration. They may not just make it to that last little bit on the scalp because
That's
you have
so
a white
interesting.
streak. Yeah, it's pretty cool. And didn't you say your mom used to, or somebody you knew
Oh, my
deliberately?
grandmother,
Yeah.
my dad's mom went gray in her early 20s, like fully gray.
Right. And that's genetic too, by the way.
Right? Because
Yeah.
my dad also, and my brother.
Mhm.
But she would dye her hair brown, but leave out this front streak of gray. And it was her signature.
So synthetic pedballism.
Yeah,
Yeah.
exactly. So Sandy, let's get into it. So let's talk about the factors that are going to, change your skin pigmentation.
So we kind of already talked about the most common one is genetics and UV exposure. So your genetics are going to, determine how easily you burn, how dark you are, and your eye color, etc. And then UV exposure. So that's photo damage, brown spots, sunspots. The technical term for that is lentigo. We'll get a little bit into that. And then pollution. Pollution's a big one now. So I remember when I was researching for my book, and I came across this study because it's a relatively newer concept, but pollution contains, volatile molecules that are hydrocarbons that are released by fuel and all this stuff from cars and manufacturing that causes inflammation in our skin, and the inflammation irritates the melanocytes, and they pump out more color. So it's been shown in clinical studies, and one that was fairly robust, it was randomized controlled, that people that live in cities where there's a lot of pollution, they will have more skin pigmentation in the form of these brown sort of lentigo things. And along that line is smoking. So smoking can increase the pigmentation of your skin. It can also give you that kind of, that sort of sallow, yellowy kind of. So right above the lip, we often call them smoker lines. Now, a lot of people get them without smoking because that's sun damage and also just the muscle contraction. But you will really damage your collagen and elastin through all the chemicals that are released, these hydrocarbons, and you cause damage to the collagen, in particular the elastin, and you get all this sort of bubbling and you get yellowing. It's not a pretty sight. So smoking is in vaping too. And then the last thing there would be like injuring your skin. If you injure your skin, you can pigment. It's a very big problem in patients of color. Like a lot of times they'll come in with acne and they could give two hoots about their acne. They're just like, I got all this brown stuff. I go, well, the brown's there because of the acne. We focus on the acne. The brown is a downstream problem. And I'm forever saying that with patients of color with acne, because the pigmentation is more problematic to them than the acne.
And I remember we were talking about this earlier when you and I were in Peru, and I got tons and tons of mosquito bites all over my legs. And even after they had all healed, I still had a lot of brown spots where I had been bitten.
So the technical term for that is post-inflammatory pigment. So again, when you injure your skin, the melanocytes that are in there get mad, right? And they're like, you injured me. And so they're trying to fix themselves, or they pump out more pigment. So that's the injuring of the skin can be in the form of actually scratching it, cutting it, or acne, or something else. And then you have a pigment that is left afterwards. Now, the pigmentation does go away in 3 to 6 months.
Yeah, it did.
Yeah, it can take longer. Sometimes the lower legs can take a little longer. But that type of pigmentation is tough to treat. It's hard to treat because it's usually deeper.
Okay, so let's get into, again, we're being marketed all of these products, over-the-counter products that can that are directed towards skin pigmentations or issues with skin pigmentation. And actually, I mean, it's this industry has generated over $20 billion of sales in marketing, to help people with skin pigmentation.
Yeah.
So my question to you, what's the science behind these creams? Can these creams actually, reverse this, production of melanin?
Well, they can decrease it. I mean, I think we watched a few things before we recorded this episode, Instagrams and TikToks. I don't like the term reverse. And I know some dermatologists use that. You can't really get rid of wrinkles and get rid of pigment or get rid of photo damage with a cream. You can improve it. So I don't like the term reverse, because that's sort of, you're overselling what it can actually do. I mean, a lot of the creams, and we're going to get into that, the targeted creams or products, ingredients, will decrease the melanin production. They'll shut down the enzymes or slow down the enzymes. I think before we get into like how they work or what they are, we sort of should talk about what are the most common things that people ask about with pigmentation, and the number one is melasma.
Yeah. I mean, I had only heard of melasma, I guess, just over 20 years ago when I had a friend who was pregnant, and after her pregnancy, she talked about having this pregnancy mask.
Yeah,
and it was brownish spots or brownish patches actually on her face. And because it was almost more on the outside, that's why I think it had a almost mask effect.
Yeah.
But to be honest, I had never really heard of it before then. And then, of course, learned that was called melasma.
Melasma. So the other term for that is cholasma, which cholasma in Greek or Latin is the mask of pregnancy. And it's interesting, whenever I research for these topics, I sort of take a deep dive on the history and the definition. So melas is Greek for brown or black. And if you look at, the ancient history, Greeks, even Hippocrates, they looked at this sort of mask of pregnancy as a fertility. Like it was an
indication
glow.
of fertility.
It was an indication of, pregnancy glow. It was now no one looks at it like that at all. And the other big thing, let's sort of take a dive. We're here now on melasma, right? So melasma is probably one of the most common skin pigmentary things that patients want to know about. And I'm sure there's a lot of people listening to this podcast who are like, yes, I've had that, or I know a friend who've had it. We have a good friend that we've seen, and I've seen her professionally. So melasma is interesting because what's the association with pregnancy? The association is estrogen. So melanocytes, again, those are the cells that make the melanin that gives us the color. They have estrogen receptors. So when you're pregnant, you've got more estrogen hanging around. So you can hyperpigment on the nipples, the linea alba, which is a line between.
Oh, I had that.
Yeah,
for sure.
Because all of those areas.
So maybe finish
estrogen.
The line, because you
linea alba is the line that goes from your belly button down to the pubic area, and it often darkens in people that are pregnant.
Yeah, I definitely had that.
Yeah, so that's responding to the estrogen receptors, right? And so, but also birth control pill. So, back in Greek times, there was no birth control pill. So the glow was only with pregnant women. But now we get people who have highly resistant melasma when they go on a birth control pill. So it seems to trigger something. And that's another thing. I don't know that there's science on this, but some people are like, I never had melasma for years and all of a sudden I got it. Now, many women get it in pregnancy, which I think our friend did. But some people will get it when they go on birth control pill and they don't realize. And then also the UV index is increased, the ozone's decreased. So the amount of UV that's coming through and that's the last part of, there's sort of a triad with melasma. You have to have melanocytes, increased estrogen, and UV exposure. So if you have high UV exposure, and melasma is very common in places like the Mediterranean, Portuguese, Italian, they often, and sub-Sahara Africa, a lot of brown pigmentation on the face that is really resistant to treatment. So, melasma is a big, big pigmentary issue. The last thing I wanted to talk about with melasma is there's different depths. I remember we were watching that video about the iceberg melasma. So not like there's a superficial melasma and then a deeper one. So what does that mean?
I'm guessing the deeper one is harder to treat.
Absolutely,
Right.
because the melanin pigments in the dermis, which is harder to access with creams and lotions and even lasers. And actually, well, let's talk about treatment now because laser is not a great option. So, okay, so we've got melasma. It's upper cheeks. We never talked about where it is on the face. Upper cheeks, upper forehead, mustache area, and sometimes along the jaw. It can be precipitated by pregnancy. It can be precipitated with birth control. And it can just come out of the blue when you go on a vacation in a really high UV index location.
Can it also be precipitated by HRT? Because that's
So, it's
hormones.
interesting. We did talk about that a little bit. I don't see that as an issue so much, but if somebody's already usually they've developed melasma way before menopause, right? In pregnancy or something, birth control. And so if they have really resistant melasma that isn't responding to therapy and they're on HRT, it's a discussion I might have. Okay, do you want brown on your face or do you want HRT? I mean, I think at this point, now that I'm 50, I'd run HRT and I'd cover up my brown.
Right.
So, but
Fair
I think
enough.
we could probably tackle both with the therapies we have because we have really great therapies for melasma. So let's talk a little bit about that. Do you know or have heard of hydroquinone?
I do. I have. Yeah.
Yeah, hydroquinone gets a bit of a bad rap, but it's a chemical ingredient that is added to skincare and prescription skincare to help decrease melanin production. So it blocks production.
So I'm guessing if it's a prescription, it would be a higher percentage of hydroquinone.
Yeah. Again, it has a bit of a bad rap. Like you used to get it over the counter. It's pretty hard to get now because there's a lot of negative connotation associated with hydroquinone as toxic and this and that. And just full stop, I'm not going to go too much into it. I don't believe that that's the case. But there's a formula, prescription formula that's used all around the world. It's named after the doctor who just prescribed it or described it first, Dr. Klegman, and it's called the Klegman formula. It's hydroquinone, retinoic acid, prescription strength, and a hydrocortisone. The reason we mix those three together is because the concentration of the hydroquinone and the retinoic acid are quite high and they irritate the skin, so we put the steroid in it. So it's only meant to be used for a few months. And, our friend that has melasma, really resistant melasma, she's done really well with it. And I actually cycle it. So this is a good tip if anybody does have and has used this formula and it's worked. You have to take a break after 2 months, mostly because of the steroid. But you can be on it for 2 months and then off it for 2 months and then on. So you can keep going back and forth because you're taking a break. And in the 2-month period, you can use other things like what we're going to talk about, retinoic acid straight up or retinol. You can use things like azelaic acid. So a lot of the treatments that treat pigmentation.
And lasers, or
we're going to
we'll
get to that.
that.
But just the topical stuff is like azelaic acid, niacinamide, retinol, vitamin C. They all tackle the pigment production. They all decrease the pigment production. Some of them decrease inflammation in the skin because inflammation, like from pollution, can cause pigmentation. So if you have a cream that is anti-inflammatory, that could help with pigmentation. That's like the niacinamides and the azelaic acids. And then we have this really cool new drug called tranexamic acid. So tranexamic acid is cool because it's used to treat menstrual cramps in an oral form, in a pill form. but it was discovered to decrease the enzyme that produces melanin. And I give it to really resistant cases of melasma that have deep dermal pigment in a pill form for 12 weeks, and it often clears them up.
That's amazing.
Yeah.
So, Sandy, okay, we talk about cycling, using certain prescription medication and then going off it for a while. But then in between, we want to, we're going to be going out in the sun. Obviously, we're wearing sunscreen. But
the one thing we didn't talk about is number one treatment for melasma
is sunscreen.
Sunscreen.
But there's a specific ingredient that is iron oxide.
Because some of the new research with melasma is that there's a visible, so there's ultraviolet light, which is coming from the sun, right? But then there's visible light. So the lights we have right here. So there's some evidence that actually can contribute to melasma, even the blue light from the computer. So the whole kind of trendy thing, it's not trendy, there's science to it, is iron oxide. So there's titanium dioxide, right? But then there's this iron oxide, which is...
So it's an ingredient in your sunscreen. So if you go to the drugstore, you can look for no, maybe?
It's not necessarily on the bottle. So that's why you have to listen to these podcasts.
Oh, shoot. Right? Okay.
Yeah.
So how do we find it then?
Well, again, it's going to be in sunscreens that have a lot of science behind them, that they actually know this research. They look into it. I think it's a bit more of an expensive ingredient. So I know that Bioderma sunscreen, their Photoderm Nude Touch has iron oxide in it. And some of the other, well-known drugstore brands that have great science for their sunscreen. Like, you get a small little mom and pop shop or a little company that makes a mineral sunscreen. That's great for day-to-day use, but if you have melasma, you need the science. You need iron oxide in your sunscreen. And if you're not sure, ask. Some people in the pharmacy may know. You can ask your dermatologist. You can research up on it. I mean, the internet's great when you have a question that is, you already know the answer to and you're looking for it, right? Okay. Does this sunscreen have iron oxide? It'll pop it up for you.
It'll tell you if it does or doesn't, right? It's pretty straightforward. So, let's get on to some other types of treatments. And, I had come to your office and I did an IPL treatment. Well, I also did microneedling, which was fantastic, but that's for collagen.
It has multiple uses, but let's talk about the IPL.
The IPL. Yeah. So I was using it, obviously luckily, I guess, I've never had melasma, but definitely I've had, sun damage and freckles. And that's what I used it for on my face and on my chest and neck. And I found, especially on the chest area, it really, really, it worked really well.
Decreased your pigmentation.
For sure.
Yeah. IPL, which is called intense pulse light, by the way, it's an acronym. Technically, it's not laser. It's actually a light therapy, but it's similar to the effects of laser. And it targets, it depends on what wavelength you set it at. So things in the skin, I should say, absorb different wavelengths. So melanin absorbs a specific wavelength. So you put the IPL at that wavelength, and when you put it on your skin for you, it'll target the melanin. The melanin will absorb the wavelength from the IPL, and it blows it up. Right, that's why the pigment comes up to the surface.
It comes up to the surface, and then it sloughs off.
But what's very fascinating, and I'm glad we sort of segued onto IPL, is it's not great for melasma. And why is that? Well, because oftentimes the pigment is deeper, so it's not going to reach it. But the big issue with laser, in particular, not laser so much, but IPL, so intense pulse light, is associated with heat. Do you remember? Yeah, it's hot, and that's why you can burn with it. When you heat the skin, you actually damage the skin ever so slightly, and that causes what? Pigmentation. So we don't use intense pulse light IPL for melasma generally. And, if you're going to a place that's using it and you're not getting better, they don't know.
You're not going to the right
science.
place.
Yeah. So it's a pretty well-known fact that you shouldn't, and you should never use it in patients of darker skin color. So Asian skin color, somebody that's very olive skin tone, and they have melasma, it will make them worse.
Right.
Yeah. But what can work is the other procedure you had, the microneedling.
Oh, the microneedling. We talked about that in season 1, but I was a guinea pig, and it was like I was the best guinea pig because I loved it. And I thought I thought it gave really
Yeah,
great
and if you haven't
results.
heard that episode, you should listen to it. It's great
Yeah,
because
listen to
Marlo
me getting
she
microneedled.
does a great job of you were a little scared, and then after you're like, "That wasn't so bad."
No,
But
it
let's
really
talk
was
about,
totally great.
yeah, how it can work with, melasma is, like, one of the, like, very general ways of, and it's not really works like this, but you're blowing holes into the pigment, right? You're putting a whole bunch of holes. Microneedling is putting a bunch of holes in the skin, so you're gonna like, blow it up. And then on top of that, you can put stuff over the holes. So you can put vitamin C, which decreases pigment. You can do other like kojic, other things that have been sort of decrease that melanin production, inhibit the enzyme. It's called tyronase that produces melanin. You can put that over top of your holes. So microneedling, and there's no heat associated with microneedling. So where microneedling is really winning the treatment wars is in melasma in patients of color. We almost do it exclusively. We do the Klegman first with the retinol and the hydroquinone and the steroid. And a lot of people are like, I don't want hydroquinone. Fine, we don't have to do that. We'll do other things. And then we do microneedling. So we tailor it to whatever the patient's preferences are, but microneedling is very helpful for melasma.
Okay. It's such good information to, to understand it, because if you have this and you want to, you can make decisions and you can make informed decisions on how you're going to treat yourself.
Yeah.
So let's talk about, I saw somewhere, and this is why I shouldn't always believe everything I'm seeing on these platforms, but that we get freckles as we get older, whereas I actually had freckles when I was a kid.
Yeah.
And definitely do not have freckles now.
Yeah. So again, this all comes down to semantics, right? And what the Latin word medical term is. So the medical term for freckle is an epiphyllid. I don't even know what the translation is for that. But
freckle is so much of a better word.
Yeah, it is a better word. And it's basically, remember we talked about a tan as an SPF of 3 to 5?
Yeah.
Okay. So when you go into the sun, it's summertime, you're young, and you're getting a lot of sun, and you get all these sort of dust of freckles on your central face because you haven't reapplied your sunscreen enough or worn a hat. And then they're kind of gone by the end of the summer. That's basically sort of, again, kind of akin to a tan. It's like it's accumulation of pigment from sun damage, but it's not so much that it stays, it goes away. Now, the other thing that you're talking about, which you have a little of now today, looking at you, and I don't have that much actually, because I'm very good with my sun protection.
Okay, I don't know what I have. I'm so good with my sun protection.
You are, but a lot of you down. Okay, so let's talk about that, because that's exactly, patients will come in and say, I don't know where I'm getting all these brown marks. I was not in the sun this summer, and I've been really good with my sunscreen the last few years. Well, you weren't the first 35 years of your life. So, okay, so cumulative pigment. Every time you get a little tan, every time you go in the sun, you're laying down pigment into your skin. Okay, it accumulates over time, and then you reach a threshold. It's like I would tell patients, it's like a cash machine. It's tallying. You reach a certain threshold, and all of a sudden the brown starts to come out. The other thing the other really important concept there is aging is done at an individual cell level. So each cell in our body is aging. It's not just the whole arm. Each cell in your liver, each cell in your arm is. So as the cell ages, the damage that's in there is coming forward. So, your cells can accumulate a lot of pigment, and then all of a sudden, bango. And what's that machine we talked about?
Like it overflows.
You were so hot and heavy for the Vista?
Visia.
Visia. So that will tell you can take a look at your skin through this machine, which is this massive thing that's really expensive. And it'll tell you how much sun damage you have that you can't see yet. So,
but that we might not want to see.
Yeah, you might not want to see that. So the technical term for those spots that don't go away, that start to come up with accumulated sun exposure is the sunspots. The lay term, the technical term is lentigo or lentiginous. So those are, what is the treatment for that? Sunscreen. And those are the things that actually don't respond very well to all this ingredients we talked about, niacinamide, vitamin C. They help, but if people really want to get rid of accumulated sun exposure pigment and photo damage, you need to do laser, either IPL or an actual laser. It's something called neodymium YAG we'll use as well. But the IPL is sort of the gold standard for that.
So can we discuss, what are the other things that can pop up on your skin? I know you mentioned skin tags and...
Yeah. So skin tags and seborrheic keratoses are probably one of the things that drive people to the dermatology office quite a bit. And part of it, not so much skin tags, but seborrheic keratoses is the technical term for brown spots that you get as you get older. And you don't have to be 80. You can start getting them in your 20s and 30s. And they're actually not pigment, but they're brown. They're the thickening of the skin. And when the skin gets really thick, and it's this top layer, it's sort of the dead skin layer, the stratum corneum, it can turn brown. And it's the reason it is so concerning for patients because they're new, they're brown, they often look weird, they bleed. And so they get scared and they come to the dermatology office. And, the $1 million question is, how do you know it's a age spot keratosis versus a mole that's changed? I can tell you 100 different ways, but if you're not sure, you go to see your family doctor, go to a walk-in clinic. There's apps that sometimes will triage you. But if you're not sure, you see a doctor. And then they can send you to a dermatologist if the general practitioner is concerned. But yeah, seb-Ks are brown, but they're not from pigment.
So, okay, let's switch it up again, and let's talk about the loss of pigment. So I know there's a condition called vitiligo, which is not very common in the world, but you know if somebody has it because it's very visible.
So yeah, vitiligo is 0.5 to 1% worldwide incidence. So it is not common, but I thought we should touch on it here because again, I know that it might not be as sexy and fun, but I want patients to come, or listeners to come away from this episode knowing everything there is to know about skin pigmentation. And one of those topics is loss of it. So vitiligo is very rare, but why I wanted to mention it is just to give everybody a full view is you actually lose the color, like it's gone, depigmented. So it's an autoimmune disease where your body is producing an antibody that's attacking your melanocytes. So that, that's what Michael Jackson had, that's why it started on his wrist, and then it got worse when he had a burn with that Pepsi commercial. And then he actually depigmented his whole body. Like he got rid of all the pigment, all the melanocytes. Because
does that not leave you super vulnerable?
Yes. And it's a controversial treatment. I've never done it, and it's not done very often. And it's mostly done in patients of dark skin color because it's devastating. It can be. But that wonderful model, what's her name?
Winnie, I think.
Winnie, and she's Canadian. And she's really good at put a great face on, this is me. I have vitiligo. Take it or leave it. This is beautiful too.
Right.
So I think it's great.
Yeah, absolutely.
Yeah.
So I showed you just before we started this episode just how I've noticed over the past several years kind of little white spots, mostly on my arm. And you said that you gave them a name.
Yeah. Well,
and what is that?
So before we come to that, and Marlo's looking at her arm for the listeners, I forgot to mention something really important. Part of the reason I did want to bring up vitiligo as well is there's new treatment options. And for any listener who doesn't know, most people do know now because when you have vitiligo, it's devastating, especially if you have darker skin color. So there's this whole group of, not a whole group, it's a group of medicine called JAK inhibitors. It's an acronym for a specific inhibitor. It's inhibiting the immune system, and you can get your color back with these. They're very expensive, though. There is one that was just released in the US and Canada. It's a cream. It's a topical JAK inhibitor, and I've given it now to my first 2 or 3 vitiligo patients. So I'm really excited to see them come back because you can bring back the pigment in the studies. So just to finish off of that, what you have, my dear, and it's on her arm, is because Marlo is probably Fitzpatrick 2. You can tan, but you burn very easily, right?
I can't tan.
Okay, so you're Fitzpatrick 1 then.
Yes. My husband says I tan beige.
You tan beige, okay.
Yeah.
So
I go from white to beige.
Well, that means you're getting a bit of color.
Yeah, very, very,
Okay,
very.
you're Fitzpatrick 1.5. Okay, there you go.
Whatever that means.
So because you have a higher risk of, sunburn, you've probably accumulated a lot of sun damage over your lifetime because let's face it, when you were a teen, sunscreens weren't that great. You probably weren't as diligent. The knowledge wasn't there. So just like you can get extra pigment, so you get these sunspots, these lentigo, you can actually have loss of pigment. So you can get these little white spots. They're like guttate in Latin means raindrop. Hypomelanosis means less pigment, but not loss of pigment. So the melanocytes just kind of gotten old. It's
Just like the rest of me.
yeah, it's got some sun damage, and so you're getting white areas, and you don't get them as prevalent as the brown areas. And you know where this is a big problem is in patients of color. So again, like phototype 5 would be very, very black, dark skin. And patients will come in and say, I've got all these getting all these like little white marks. What the heck is this? I go, that's sun damage on you. So that's a form of sun damage in patients of color. And it can just happen with age as well with them because their melanocytes start to just peter out and somewhat genetic.
Okay, let's talk about some other ingredients, like some over the counter. And one I mentioned to you that they are actually talking about as an ingredient to treat melasma.
Yeah.
Is turmeric.
Oh yeah, turmeric. But I think we're going to go through some social media like ingredients and like what's sort of hot and trending, right? Yeah, turmeric. So I think you asked me about this and I was like, that stuff doesn't work. And then again, so I went back and I read about it and any kind of ingredient that is touted to help with pigmentation is going to decrease the working of that enzyme, that tyrosinase, which the melanocyte uses that enzyme to pump out pigment, pump out melanin. So what did you ask me? Kojic acid? So,
well, it's so I asked you about these.
Oh, turmeric. Turmeric.
Well, turmeric. So it's these actual pads.
Yeah.
Look like a round makeup pad that are soaked in turmeric and kojic acid, and that you use like to scrub your face. And so the first thing you said to me, which I understand, is that it could be irritating to your skin. So you have to. I mean, I did order them.
Yeah.
They haven't arrived yet. It's very dangerous when you can just shop now. Yeah. When I've ordered them, and I'm actually interested more in the collagen production.
I don't think the science is there for that as much. Okay, so I did look into turmeric, and we can come back to kojic acid. But so turmeric is a very powerful antioxidant. And let's actually break that down. What the hell is an antioxidant? Okay, so when you go out into the sun or you go out into pollution or you smoke, you're producing these bad things, these superoxide radicals, was what they are, in your skin, and that causes damage and inflammation. You also jumpstart enzymes that break down collagen and elastin. So what you want is something to go in the skin, and think of it like a sponge. It's going to sop up all those super radicals that all this UV pollution has caused. So you put that on your skin, it's absorbed in your skin. It's a sponge. It's going to sop up all these free radicals. The free radical damage from pollution or sun causes pigmentation. Because again, when the melanocytes get irritated, they get angry and they start pumping out more pigment. So if you have something that's going to decrease that irritation, which turmeric does because it's antioxidant, it's going to help. Also, turmeric decreases the enzyme tyrosinase, which produces melanin. So again, it's got a double whammy.
Okay.
I think
so interesting.
And kojic acid is the same. It helps decrease that enzyme function of which produces melanin. So, and then the scrubbing action is you're just delivering it a little bit more through abrasion of the skin, right? But if I'm looking at you, and listener, you don't see Marlo, she's a beautiful woman. She doesn't have a lot of melasma. You don't have any. You have very little pigment because we lasered it off you. Why do you need these? You don't actually need them. And you might irritate your skin. So I think it's trendy and it's fun, but you don't have a lot of pigment. And these types of treatments are much better for melasma than the sun damage stuff. The sun damage stuff, the pigment with sun damage, if you have a lot of it, you can, decrease it by a few percentages with topical pigment decreasing chemicals, all the ones we've talked about, but you can't get rid of it.
Right.
Save your money and go get an IPO.
Right.
At my office, preferably.
Well, of course. Where else am I going? Okay, but let's talk about some other over-the-counter like ingredients we're looking for.
Yeah.
Right. Let's just do a hit list.
Okay.
So a hit list of ingredients.
Can I interrupt?
Yes.
Let's do a hit list from best to not so good.
Okay, from best to not so good.
Okay. And not so good, just less activity.
Okay, less effective?
Less effective.
Okay, and
so you rhyme them off and I'll kind of say good, medium, not so good.
Okay. But these are to targeting specifically problems with skin pigmentation. So this could be sunspots or melasma.
Yeah.
Okay, so niacinamide?
Yeah, pretty medium. Yeah.
Oh, that's a medium.
Yep.
Okay. So,
Well, compared to retinol, it's
okay.
medium.
Got it.
Right?
So, tranexamic
Yeah.
acid.
I'm not sure topically. We don't have a lot of the studies topically, but I told you I use that oral or in an oral form, in a pill form for 12 weeks, and it can clear up really resistant melasma.
Oh, wow.
So
Okay.
topically, it is added now to some creams. It can even be used over microneedling. Like we do have a solution that we'll put with people that have quite significant melasma. We'll put the tranexamic acid over the whole. So I think it's a medium one. Again, like there's some science. Yeah.
Azelaic acid.
Azelaic acid is good. It's you can get it as a prescription. You can buy it over the counter. It has sort of a dual action of pigmentation and acne.
Okay. Alpha arbutin.
Very good. You're whipping
Oof.
these out. Mild.
Okay.
Mild to moderate.
Bakuchiol, which is
Yeah.
also one that keeps popping up as a
Yeah.
instead of using a retinol, as a
it's
gentler retinol.
It's derived from a plant, a seed actually, and it's from Ayurvedic medicine, so East Indian medicine, and it looks like retinol chemically, so it binds to a retinol receptor, but it's not retinol. So it's what we call in chemistry a functional analog. So it functions the same as retinol, but it looks nothing like it. It just happens to bind to the receptor. And there is a good study of the British Journal of Dermatology comparing 0.5% bakuchiol to 0.5% retinol, and they're analogous. So it's been around a while now.
But apparently more gentle, not
It
as
is more gentle.
irritating.
Because
That's
it's not
the big thing about it, right?
because it's not retinol.
Got it.
It just binds to the receptor.
Interesting.
Yeah.
Licorice extract.
Very mild.
Okay. So this was the kojic acid, which is these pads that they're often they have bars of turmeric and kojic acid, like a soap bar, and then these pads I've been seeing all over the place.
So a lot of the ones we talked about, like almost all of them, they're going to be added to, like, because they're mild. So you'll see turmeric and kojic acid. You'll see arbutin and niacinamide. You'll see them added together because they're all helping, but they're mild.
Okay. And then retinoids.
Retinoids are, still
Gold standard.
The gold standard. And then we didn't talk about, I don't know what's on this list, is vitamin C.
Oh, right. Yeah.
Vitamin C definitely has clinical studies to show that it decreases skin pigmentation. And it's an antioxidant. Again, it's a strong antioxidant. So if you decrease the oxidative stress in the skin, you're going to get less pigmentation from UV damage and pollution.
Amazing. So Sandy, if we're going to give some takeaways to end this episode, it sounds like there's a lot of really interesting science and ways to help people who have melasma and who have these issues. A lot of over-the-counter ingredients. I mean, you have to know what you're buying. And then a lot of treatments you can do at your dermatologist's office. And I guess, is there one that we haven't talked about that's maybe the future?
Pigmentation? I don't think so. I mean, tranexamic acid is the newest one. I think for a take-home message, we had Doris Day on our first season. Her classic quote is, "Nothing looks as good in your 50s as sunscreen in your 20s." I mean, sunscreen is still the gold standard for skin pigmentation, both melasma and the accumulated sun protection or sun damage that you get with the brown lentigines. So sunscreen, if you've got melasma, look for one with iron oxide. Go to your dermatologist first to get a first pass with some topical creams, like, prescription strength, hydroquinone or not, retinoic acid or not. Then you can, buffer that with all of these ingredients we just went through. If you have melasma, microneedling with stuff over top of it to help decrease the pigment. And if you have sun damage, photo damage, pigmentation, IPL, or other lasers that target that. And that's pretty much it in a nutshell. Save your money. If you really have bad pigmentation, don't buy all these creams. Like they're good to use after you've done something, because they are not strong enough on their own to really deal with really significant pigmentation issues on the face.
Okay. Well, that is tons of information, but I found really super interesting. So thank you.
Thank you so much for listening. Make sure you check into our social media feeds if you want to post any questions or ask any questions, and we'll see you next time on Skin to It.
Please let us know what you thought of today's episode.
If you have any questions or thoughts, send me a message on social at Dr. Sandy Skotnicki. And don't forget, all the links and resources we mentioned are in the show notes.
And if you haven't already, please subscribe and leave us a review. It helps us to bring you the content you love.
Until next time, take care, and we'll see you next week on Skin to It.